Well, good morning and good afternoon, everyone. My name is Kristan Gross. I am the Global Executive Director of the Vision Impact Institute. We're based in Dallas, Texas. Thank you for joining us for the Global State of Vision Care focused on the Middle East. It's my pleasure to host you today with speakers from the World Health Organization, from Essilor, and from IMCO. I'll do a very quick run through of the agenda and then cover some housekeeping items, and then we'll move directly into the presentation. First of all, I will introduce briefly the Vision Impact Institute. We'll have opening remarks from Hassan Awada. Alarcos and Stuart will present from the World Report on Vision from the WHO. We'll have Anurag Hans from Essilor presenting the Eliminating Poor Vision in a Generation report. And then Kovin Naidoo will speak to us about how these two reports actually tie into the context of vision care as it relates to today and tomorrow. And then we will host a Q&A. A couple of things to note: we will be recording this presentation. We will share with you the link to the presentation at the end. Probably within the next 5 to 7 days, we will share this with you. Along with some other information, we'll share this presentation. We'll share a one-pager that kind of talks to both of the reports and allows you to see them side by side, and we'll also share the reports. At the moment, I'm going to take a quick minute just to tell you about the Vision Impact Institute. If you're not aware of who we are, the Vision Impact Institute is a global nonprofit organization that was established in 2013. It focuses on the impact of poor vision and research as a basis for this. Our mission is to raise awareness about the importance of vision correction and protection to make good vision a global priority. What we found is that while people understand that good vision is important, it is definitely not a priority on the healthcare spectrum, or has not been to date. We are seeing multiple changes in this area, and that's the reason that we're bringing you these two reports. We provide an evidence-based awareness and advocacy resources. On our database, on our website, visionimpactinstitute.org, we have a database of more than 500 studies on the impact of uncorrected vision and the benefits of correction. As you can see, you look at our independent advisory board. We have advisory board members from the US, the UK, China, India, Switzerland. We have a plethora of leaders who are dedicated to helping us reach our mission. The executive team below, today we have on the call, I'm obviously on the call. We also have Andrea Kirsten Coleman, who is our communications manager in the US, and Eva Lazuka, who is representing your region. Anything that we can do to help you beyond this time, Eva would be your contact. And now I'm going to turn it over to Hassan. Hassan, if you would like to say a few words to just kind of introduce who you are. I'm assuming all of the people who are on this presentation know who you are, but would love to have you just invite us in. Thank you.
Thank you, Kristan and Kovin, for organizing this webinar. After reading the World Report on Vision, which highlights the extent of the problem associated with the uncorrected refractive error, in terms of the number that exceeds 1 billion people globally and its negative repercussion on the economy in general and the quality of life of these people, we feel sad and shocked when we know that there are a number of people who live with visual impairment because of their inability to obtain medical glasses because of poverty or the inaccessibility of optician or optometrist or ophthalmologist. Several screening campaigns have been organized in several countries of our region, organized by local associations, local optometry association or NGOs, in collaboration with IMCO. These campaigns were done in different regions, in different economic and social classes. We have wage campaign in towns, big cities, villages, and especially in the Syrian in Palestinian refugees camps. The percentage of people who had an uncorrected refractive error varied between cities and villages and rural zones. But the biggest surprise was in refugees camp, where the percentage exceeds 50% of children who go to school. It was a very, very big number. Through our work with IMCO and WCO and our participation in many meetings with many organizations working in the field of prevention of blindness and eye care, such as IBP or BHVI and many others. Multiple programs have been told about to help the poorest people get access to eyeglasses, help them live a normal and productive life, thereby helping them to improve their social and economic status. But honestly, as IMCO and as professional optometry associations in the countries of our region, we have no role in these programs. And we did not feel that there was really activity on the ground. So we only hear about numbers, about these programs, about publications, but we never feel real activities on the ground in our region. I don't talk about Africa and other regions. So for this program in our area, we have a lot of optometrists are present in all countries of the region, and they are highly qualified, whether scientifically or in practice. So my message is we have to have a role to play in the implementation of future programs in the project to be developed under a 2050 plan. So we are here, we are professional, we are ready to help you and other, and also WHO, IBP, all the other big organizations looking to help population and to reach this population with incorrected refractive error. We are in the ground, we are present, and we are ready to help. This is my message, and thank you so much.
Thank you again. We appreciate your partnership in helping us to publicize the webinar to make sure that those people who are attached with IMCO are really educated on these reports, that they can understand how this impacts not only their businesses, but the future of eye care as well. So thank you so much. Our next speakers, actually, I have the wrong title slide, apologies. Alarcos, Cieza and Stuart, Keel from the WHO are going to speak to you for just a moment. I'm going to stop sharing my screen so you can see theirs. And we will spend some time with you understanding the World Report on Vision as it relates to your business today. So Stuart and Alarcos, go ahead.
Thank you.
Excellent,
so
Alarcos.
much, Kristan. I'm Alarcos Cieza. I'm the person leading the program on eye care and vision at the World Health Organization. And I'm really extremely pleased to be here with all of you today. I will provide simply a couple of introduction words, and then Stuart, my colleague at the World Health Organization, present to all of you the details of the report. I have to say from the outset that I really endorse and like the words that Hassan provided to all of you, because actually, if we have a message to give to you today, the perspective of the World Health Organization is that this world report is also your agenda. It is a world report that is the agenda of all optometrists around the world, and it is also the agenda of all of you joining today. And that is what we would like to portray. You will see also, based on the numbers, based on the actions that are presented in the world report on vision, that you can embrace this agenda and is to move forward with all of us, with all the stakeholders, also with the World Health Organization, to move this agenda forward. One may ask why WHO decided to put together a world report on vision, being actually a program at WHO that has a lot of tradition and also a field that has already done a lot of work. And the reason for that was that we realized, and actually our member states from the World Health Organization asked for it, because it was a strong feeling that it is necessary to put the eye care agenda in the context of the global agendas, of the context of agendas like the Sustainable Development Goals, like the agenda of Goal 3 on health, and more importantly, in the context of universal health coverage. And there was a need then to really, firstly, to summarize all existing evidence that provides us with the numbers, the global magnitude of vision impairment, how many people live with vision impairment, but also how many people have eye conditions that also need care independently whether they are associated to vision impairment or not. Also, a need to take a stock about the progress that we have done so far as a field. And this progress is huge, but we all realize that there are certain challenges coming in front of us that we need to address. And these challenges are really relevant for all of us and are relevant, most importantly, for all of you with your profession. And thirdly, because it is important to provide a vision towards the future, what we need to do in order to address those challenges. And it is something remarkable for WHO to put forward a world report on something. So it is really, it has a tremendously relevant for the agenda of WHO, but also for the agenda of member states, as we will see at the end of our presentation, to have a world report on vision. And the significance was also that this one is the first ever world report on vision, the first time that WHO has put forward such a document. So without further delays, then I would like to pass the floor to Stuart that will tell you much more about the details contained in the world report, so that you can realize why I'm saying with so much confidence that this is, most importantly, your agenda, not the agenda of WHO alone. Thank you. Stuart?
Yes, thank you, Alarcos. Thank you. So, I will move forward. It's very, I'm very happy to be with you here today. My name's Stuart Keel.
Stuart, we cannot hear you.
Yes,
okay.
Yeah,
Thank you.
Very good. So I will start off with some good news and just going through the World Report on Vision. So, of course, over the last 30 years, there's been considerable efforts that have been made in a number of areas that have led to improvements in eye condition and vision impairment. So we know that global advocacy efforts have been launched, and most notably we have Vision 2020, the Right to Sight, that you'll all be aware of, which really has been pivotal in achieving unified and coordinated advocacy for key priorities of action in the field of eye care, not only at a global level, but also regional and at a country level. So we have had 4 World Health Assembly resolutions during this period, during the last 3 decades, that have really maintained this momentum, most notably, as I'm sure you'll be aware of, the Universal Eye Health Global Action Plan that actually came to an end at the most recent World Health Assembly that was held virtually last week. So it's very timely, as Alarcos mentioned, that the World Report on Vision was released by WHO to really set the scene from a WHO perspective for the way forward. Of course, we have also had eye infections and blindness due to infectious causes of eye conditions such as trachoma, onchocerciasis and vitamin A deficiency that have reduced in all regions over the last 30 years due to the successful implementation of large-scale public health initiatives. We've seen increases in cataract surgery rates in many low and middle income countries, and we've had scientific and technical advances that have led to improvements in access, but also in diagnosis, management and treatment of eye conditions and vision impairment. So that's just to point out some of the key areas of progress over the last 30 years. So now to move on to the challenges, and one of the key challenges that the eye care sector faces is really just the huge need for eye care. So if we think that everyone, if they live long enough, will experience at least one eye condition in their lifetime that will require the appropriate care. That's a huge number of people, and of course many of these people will require routine access to care and have chronic conditions. So looking at the number of people with eye conditions that can cause vision impairment really highlights just how the magnitude of this issue. So we have close to 200 million people globally currently with age-related macular degeneration. We have 150 million people with diabetic retinopathy. We have nearly over 75 million with glaucoma, close to 3 million with trachomasis who require access to surgery. And then we have the huge number of people, as was alluded to earlier, that have a refractive error, are largely driven by myopia and near vision impairment due to presbyopia. So what really accentuates this challenge and makes this challenge greater is the fact that we have changing demographics such as an aging population and also population growth that's going to lead to a significant increase in the number of people with age-related eye conditions such as cataract, age-related macular degeneration and glaucoma, as you can see on the slide. But also we've got changes in lifestyle, and we're seeing a significant increase in the number of people with diabetes who as you know, require routine access to care, and also diabetic retinopathy who require more regular monitoring and access to treatment services. And as you will know, we have lifestyle factors have strongly been implicated in a significant increase in the number of people with myopia, and in particular, less time spent outdoors is strongly linked as a lifestyle factor that is driving this trend. So the take-home message here is that these demographic changes will impact profoundly on the already strained health systems and eye care workforce that we have today. So one thing that the World Report on Vision also brings to light is eye conditions that don't typically cause vision impairment and the importance of these conditions. So these conditions are very important for two reasons. Firstly, they're the leading reasons for people seeking care, and therefore they clog up waiting rooms everywhere we go in secondary and tertiary levels of care. But also, of course, given that people need care for these conditions, they're also exposed to personal and financial hardships associated with the treatment needs associated with these conditions. So really, these conditions are very important to consider in future planning for eye care services. So looking at vision impairment now, and as presented in the World Report on Vision, and as mentioned in the introduction, we can say comfortably and conservatively that at least 2.2 billion people today have a near or distance vision impairment, and really putting the emphasis on the term at least, as due to limitations in current data, we know that this, as I said, is a conservative estimate. Of these, at least 1 billion have a vision impairment that could have been prevented or is still to be addressed. So those that could have been prevented, including conditions like glaucoma and diabetic retinopathy. Of course, if detected early and appropriately managed, the majority of cases of vision impairment from these conditions could have been prevented. And then we have the huge unmet need for care associated with unoperated cataract and unaddressed refractive error at both near and distance. And of course, there are cost-effective interventions available to address these conditions. So moving on now to a second challenge, and one of the second challenges is that we have very little knowledge in a number of areas. So going back to my emphasis that I placed on the term at least 2.2 million have a vision impairment, really we don't have a good understanding at the moment of the met eye care needs due to the way in which data is collected in population surveys in the field of eye care that's based on presenting visual acuity. That gives us a good idea of the unmet need for care, but currently we don't understand the number of people out there who have a vision impairment due to refractive error, who already have glasses to compensate or to correct their refractive error. And the reason why this data is important is because health systems are really required to sustain care for these individuals whose needs are being met. So therefore, moving forward, we need to make sure that we systematically collect data on not only the unmet needs, but also the met needs in order to conduct effective planning. A second area where knowledge is lacking is a paucity or a shortfall in health systems and implementations research in the field of eye care. And particularly, this is relevant to eye care particularly because of the high potential of eye care benefiting from technological advances. So this type of research is very important to ensure that these advances really impact on the clinical care of people's lives. And thirdly, we have weak health information systems when it comes to eye care. So even in those countries with very developed information systems, they often don't include relevant data on eye conditions, vision impairment, and their determinants. Consequently, the decision makers who allocate resources are unable to do this in an evidence-based fashion. So it's very important that we focus on strengthening data in these three areas. And of course, as you all know, we have barriers and challenges relating to utilisation of care. And we know that the utilisation of eye care varies quite considerably between regions, between high, low and intermediate resource settings, and even within countries themselves. So, of course, the utilisation is impacted by a number of factors, including the availability of services. And if we think about the availability of services, a shortage of trained human resources in eye care, including optometrists and ophthalmologists, really is one of the greatest challenges for us to increase the availability of eye care services. And of course, several factors really accentuate this challenge in terms of the unequal distribution of services. We know that eye care is predominantly provided in urban centres and larger regional areas in secondary and tertiary levels of care, which means, of course, those individuals residing in rural and remote areas have more difficulties in accessing care. But also there is at times challenges in terms of coordinating the workforce and the retention of the workforce that poses challenges to the availability. We know that many barriers related to accessibility, for example, gender in many countries, socioeconomic status, and even the perceived costs of accessing care really can prevent patients from accessing services. And if we think about the affordability of side of things, we know that direct and indirect costs of accessing care really are major contributors to the utilisation of eye care services. And what's not mentioned on this screen is the importance of acceptability of eye care services that really impacts on utilisation. And as you'll know, in optometry, this is particularly important, given, it's been shown by previous research that the acceptance of wearing spectacles, for instance, is influenced by a number of factors, such as cosmesis and beliefs. So all of these factors need to be taken into consideration in terms of utilisation of services. So all of these challenges really have resulted in vision impairment not being distributed equally across the globe. So we know in what we present in the World Report on Vision is that the rates of vision impairment and blindness in low and middle income countries tend to be at least 4 times higher than many high income countries. We also know that even within countries, even within high income countries, there's several high risk groups that face inequities in accessing services, but also an unequal distribution of vision impairment. And these include those in rural areas, women, older people, Indigenous and ethnic minorities, and people with disabilities. And even those with vision impairment that can no longer be treated, in order to maintain value and to optimise their lives, there really is poor coverage of vision rehabilitation services globally, which is another challenge facing those who already have vision impairment that can no longer be treated or addressed. So you may think, how can this be? We have a field of eye care that has effective eye care interventions covering the continuum of care that address the needs of eye conditions and vision impairment. And some of these interventions, such as cataract surgery and refractive error correction, of course, are the most feasible of all health interventions to implement, and are very cost effective. So how can this be? And one of the key reasons for this, and as set forward in the World Report on Vision, is a lack of integration of eye care within the broader health system. So in the eye, and a few examples of this, in the eye care sector, we tend to have vertical programs that run in parallel to the public health system. We also have a lack of, we know that the private sector in most countries and the private sector in eye care in most countries is very strong, but we tend to have a lack of coordination with the private sector and between the private sector, the public sector, and sometimes the NGO sector. And we tend to also have an uncoordinated and unregulated workforce in many low and middle income countries. And to really emphasise this, we collected some data at WHO, and a third of countries in which we collected data did not recognise optometry as a profession or did not have an educational requirement. So in this instance, productivity can be diminished because a section of the workforce, for instance, optometrists, are not accredited to carry out services independently, which has an impact on the efficiency of services. And as I mentioned before, eye care tends not to be a part of the health information system. So we think about integration of eye care in the health system, and we think about the most superior level of this. Every country has a national overarching development or strategic plan. So in this strategic plan, you have many sectors, and one of those sectors is the health sector strategic plan. So within the health sector strategic plan, we have many areas that feed into this, including the key ones in maternity child health, HIV, mental health, ageing, NCDs. And what we know is that in the majority of low and middle income countries, eye care is not part of the health sector strategic plan. And if it is not, then it basically means that eye care is not going to be prioritised and budgeted for in terms of including eye care interventions within health service packages. So in order to move forward, eye care really needs to be an integral part of the health sector strategic plan. So now looking now at what does the World Report on Vision recommend to move the agenda of eye care forward, and we'll focus on the key recommendations of the World Report on Vision. There are a couple of others, but focusing on the primary recommendations of, as Alarcos mentioned, making eye care an integral part of universal health coverage and implementing integrated people-centred eye care into health systems. So I'll break these down in a bit more detail now. So when we think about eye care and we think about universal health coverage, we know that to address many of the challenges, particularly those related to inequities in access to services, eye care needs to be an integral part of universal health coverage. So even basic eye care interventions and medicines tend not to be integrated into health packages in many low and middle income countries, and therefore individuals are forced to pay out of pocket to get access to these services and medicines. So just to explain this in a bit more detail, at the WHO, universal health coverage is generally represented with a cube. So there's three dimensions of the cube. We have the population in a country that needs to be covered. Then we have the interventions or services that need to be covered, and we can think of these as the eye care interventions that need to be covered. And then we have the costs that need to be covered. So this cube in the center here really represents the situation in most countries, although the cube tends to be larger in high-income countries, with the challenge being that the cube is always smaller than the services that need to be covered. So in order to close this gap, really, and to move towards universal health coverage, countries need to advance in 3 dimensions. So firstly, priority services really need to be expanded. Secondly, more people need to be covered. And thirdly, out-of-pocket payments need to be reduced. And I'll just highlight now a tool that is currently under development at WHO headquarters at the moment, and the Vision program is leading this tool. It's the development of a package of priority eye care interventions. And the purpose of development is to really support the implementation of eye care in universal health coverage within countries at the top level. So this package will include evidence-based eye care interventions, including the resources required for their provision, such as the health products and also the workforce requirements that can be used by countries to plan, budget and integrate eye care interventions at all service delivery platforms. So we're following quite a systematic approach to this development. As you'll see at the bottom of the screen, just an overview of this approach. I won't go through that in much detail now. But just to say that this package is expected to be developed by 2021. We will then integrate this package within related programs within WHO, such as maternal child health, diabetes and ageing. We will also integrate this package within a larger and a broader tool at WHO, which is called the Universal Health Coverage Compendium of Interventions. And this includes interventions and priority interventions across all health program areas in order to ensure that eye care is part of the conversation when this tool goes forward. So there is also some great opportunities, and in realising the burden and the number of people with vision impairment and blindness due to refractive error and cataract, which we know is at least 1 billion people. We know that interventions for these 2 conditions are very cost effective. And due to this reason, these conditions, due to the burden of the problem and the cost effectiveness of the interventions, these conditions and monitoring these conditions is not just relevant to eye care, but is also relevant to universal health coverage and healthcare in general. So for this reason, 2 new indicators for eye care, titled Effective Coverage of Refractive Error and Effective Coverage of Cataract Surgery, are now being considered for inclusion at WHO into what's called the Universal Health Coverage Index, which is to monitor progress towards universal health coverage. And we're in the process at the moment of working with relevant partners within the eye care sector and also member states to set targets for these indicators for countries to achieve by 2030. Now, moving on to that second key recommendation of the World Report on Vision and looking at what is integrated people-centred eye care. What does this mean? And breaking it down, what it means is that eye care services that are managed and delivered so that people receive the continuum of care from promotion all the way through to rehabilitation to address the full spectrum of eye conditions according to need, are coordinated across different levels and sites within and beyond the health sector, and recognise people as participants and beneficiaries of these services. So this may sound great, but also the World Report on Vision really sets out to achieve integrated people-centred eye care. There are a number of key strategies that the eye care sector and member states need to start moving towards, and I'll go through those key strategies in a bit more detail now. So the first one being really empowering, engaging people and communities. So this is specifically related to those underserved populations within countries, and it involves raising awareness through public health campaigns on the importance of early identification of eye conditions and the need to prevent and address vision impairment in eye conditions, and how individuals can be empowered to really gain access to care. Not only this, it includes really simplifying access to care for underserved populations through utilising technological advances in the field, of which there are many. The second key pillar of integrated people-centred eye care is reorienting the model of care towards building a strong primary care. As I mentioned before, the majority of eye care services in many low middle income countries are provided at a secondary and tertiary level of care. They're also provided mainly in urban areas and larger regional hubs. So if to strengthen eye care and primary care, we're bringing care closer to individuals and communities, and therefore overcoming barriers associated with travelling and access to care. And by doing so, we know from examples in the field that if sufficiently resourced, primary eye care can meet a large number of people's needs. For example, with the appropriate training and appropriate equipment, diabetic retinopathy screening can be conducted. We know that case finding for common conditions, common and leading causes of vision impairment and blindness, such as cataract and refractive error, can be detected and appropriately referred. And we can, and also there's potential for the diagnosis and management of those conditions that are the leading reasons for people seeking eye care, such as conjunctivitis and also dry eye, can potentially be handled in the primary eye care setting. The third pillar is coordinating services within and across sectors. And this really involves reinforcing linkages between relevant programs, as I mentioned before, such as diabetes, maternal child health and ageing, but also relevant sectors such as the social services, finance, education, and also the private sector. And of course, given the growing demands for eye care, effective options for public-private partnerships really need to be explored as a means to provide affordable eye care to the people. And there are some examples of this presented in the World Report on Vision. Last but not least, the last strategy really goes back to the key point I mentioned before, and creating an enabling environment which really reinforces the integration of eye care within national health strategic plans. And given the challenges also relating to the shortage of optometrists and ophthalmologists, it also involves ensuring that eye care workforce planning is an integral part of health workforce planning in general, and that the sector moves towards a competency-based care approach and a teams-based care approach to improve access and efficiency of care. So with that, I thank you, and I'll pass back over to Alarcos now, who will conclude the presentation.
Thank you, Stuart, for this comprehensive overview. And my final remarks going to the direction of, look, the World Report on Vision already have an impact in our member states. Based on the recommendations of the World Report on Vision, a group of about 20 member states came forward to the executive board at the beginning of this year, presenting a resolution on eye care that will motivate member states to move this agenda forward and these recommendations of the World Report on Vision forward. And actually, not only ministries of health, but also all stakeholders and civil society in the sector, and also WHO. This resolution was presented recently at the World Health Assembly, actually 1 week ago. And now, due to COVID-19, has passed to a silence procedure so that it will be endorsed by all member states if no member state has anything against the resolution and sent a comment to WHO. We cannot say, of course, what will happen, but we are very confident that that will be the case, and that very soon we will be able to celebrate a resolution that really provides guidance for civil society, for member states and ministries of health, but also for WHO, how to move the agenda of WHO forward. And I also would like to finish with the words of our Director General, Dr. Tedros, who said during the launch of the World Report on Vision, actually, we have no choice. And that is the message that I would like to give to all of you today. Actually, we don't have a choice, and we need to take this challenge forward of moving the agenda of eye care in an integrated way in the health system, so that everyone who needs services get those services. So now the ball is on you and the action is on you. Very pleased to be here with all of you, and thank you very much. I pass back to Kristan. Thank you.
Thank you very much, Alarcos and Stuart, for a wonderful presentation on the World Report on Vision and why it's so critical to our industry going forward. My next speaker is Anurag Hans. He will be speaking and presenting the Eliminating Poor Vision report from Essilor. Anurag, are you ready?
So thanks, Kristan, and thanks everybody for making the time to join us. First of all, a big thanks to everybody for who's been involved in organizing this, and big thanks to Stuart and Alarcos for a great summary of the WHO report. So what I do is I'll talk about the Eliminating Poor Vision in a Generation report. So this report was released late last year as a culmination of the need that we felt at Essilor to define a roadmap, a very practical roadmap of actions which need to be taken from now till 2050 if we want to eliminate uncorrected refractive errors. So this report, the aim was Essilor as the responsible industry leader in the field of corrective lenses. We have an ambition of eliminating poor vision in one generation by 2050. So we supported the creation of this report, which was to define this, first of all, to understand the scale of the crisis as of today, and then to try and estimate what will be the scale of the crisis in the next 30 years, and what are the actions which need to be taken if we want to prevent that. So very similar to the WHO report, it recommends a partnership approach and a system-wide change approach that you'll see in the tangible actions that it outlines. McKinsey and Company, which is the largest advisory firm in the world, their global health team, the same team which in the past has worked on the malaria report or similar reports on HIV, etc., worked on this to define the roadmap of what will it take to eliminate poor vision in a generation. So poor vision, I mean, I don't think that anybody on this call needs to be reminded of this, but it has a real social and economic impact. So we know that it is the largest unaddressed disability in the world. About $272 billion is lost in the world GDP because people can't see clearly. And 1 in 3 people approximately are affected by uncorrected poor vision. 90% of them live in developing markets, and a lot of them live in rural markets. And by 2050, over half the world's population may be affected with myopia. So just to give very broad numbers so that everybody is able to understand the state of the issue and where it's heading. But before that, just to contrast, the two reports that we are talking about. So WHO, the report that was just talked about, it quantifies vision impairment due to refractive error based on a less than 612 visual acuity cutoff. Whereas this report estimates that people suffering from uncorrected refractive error is around 2.7 billion people. This number was around 1 billion in the WHO report. So this is because in this report, the cutoff is taken as 6.9 because it was felt that even with So individuals still battle to see at distance with the 612 visual acuity. And when we are trying to understand on a day-to-day basis, how does everybody unlock productivity, we thought that this might be a better representative of what the scope of the problem could be. Now, just to set the context, what this report tries to do is to take the world as it was in 2018 and then trying to look at what the world will be in 2050. So if you look at the population growth, where will the population growth in the world come from? You can see that a majority of the population growth is actually going to come from the developing economies. And similarly, if you look at where is the economic growth going to come from, a majority of the economic growth is also going to come from the developing economies. So that means that developing economies will have more people. They will have more people engaging in productive activities, but still they will have a large number of people who would be suffering from uncorrected refractive error. So that presents a challenge and also a big opportunity. So we will try and understand what is the size of the challenge as we understand it today. So if we look at the world in 2018, the numbers would approximately be the same as at the start of 2020, but approximately we are talking about an overall size of 4.7 billion people who have refractive errors. And if you look at the split of what are the eye conditions which make up this 4.7 billion, myopia obviously is the largest of those conditions, and then followed by presbyopia and the other conditions. But if you fast forward to 2050, what the report estimates is that approximately approximately 4.3 to 4.5 billion people will be suffering from myopia. That's approximately half of the world's population in 2050. And therefore, there is a need for actions to be taken right now, from now till 2050, if we want to make sure that everybody who is affected with refractive error is able to get access to corrective solutions. Now, if we look at these numbers of 4.7 billion people having refractive error, both corrected and uncorrected, growing to 6.6 billion people by 2050, this is how it is estimated to be to evolve. So in 2018, the report estimates that out of the overall world population of 7.6 billion people, about 2.9 to 3 billion people don't need any vision correction, whereas the rest need vision correction. But out of the 4.7 billion people who need vision correction right now, only 2 billion people have access or awareness of the availability of a pair of spectacles or corrective lenses. 2.7 billion people live with uncorrected refractive error, and 90% of them live in developing countries, in rural areas, at what is called the economic base of the pyramid. Now, what the report estimates is that if the industry, the governments, the NGO sector, and everybody how they plan their programs, if everybody maintains their current focus, this is how the world will evolve till 2050. So by 2050, the approximate number of people who would be living with uncorrected refractive error is going to be the same. So about 2.5 billion people will continue to live with uncorrected refractive error till 2050. But there will be about 700 million people who will continue to live with uncorrected refractive error, even though they are able to afford a basic pair of spectacles and they're aware, but only because there is no access in the areas that they live in. So, so given this projection, the team who was leading the analysis on this report started looking at concrete actions and investments which need to be made from now till 2050 if this issue is to be solved. So what the report highlights is that from now till 2050, if around $14 billion are needed to be invested across 4 broad areas. And if that is done, then the world will be able to create a sustainable way in which uncorrected refractive error can be taken care of on a sustainable basis. And I keep stressing on the sustainable point here, because unlike, so this is what the McKinsey team highlighted when they were looking at the space of refractive error, is that this is very different from any of the other health contexts that they had worked in the past, because this is not an immunization challenge. This is not about 2.7 billion people having to be immunized once and therefore they are protected against a condition. This was about creating an infrastructure which can help service these people every 2 years, because they will need these services every 2 years. So broadly, the report highlights the need for investment of 14 billion, as I said, across 4 areas. Now, in identifying these 4 areas, while drawing from experiences from other health contexts, the team working on the report also looked at all sorts of programs which are being run currently in the eye care space. About 2.4 billion is needed to be invested in what is called sustainable access points. Now, these sustainable access points could be vision centers, could be primary vision care facilities at hospitals. It could be micro entrepreneurs who are running their own practices in rural communities. It could be primary vision care technicians. But about 2.4 billion is needed to create sustainable access points. About 700 million to innovate for both products and for screening tools. $4.5 billion will be needed to raise awareness, and this is derived from past experiences on what has taken to create awareness in other health issues where there is a behavior change element involved. And even despite creating sustainable access points, about 6.2 billion will be needed to provide subsidized and free services to the bottom 10% economic strata who will not be able to afford even the most basic and affordable pair of spectacles. So if you look at sustainable access points, the report highlights the need to create about 1 million such new access points. But these million access points will be able to equip and keep serving 90% of the population in need. Now, these million access points obviously also need to be part of a larger health system, which will make sure that there are good and strong referral networks which are built in, so that in addition to diagnosing refractive error, they are also able to spot early symptoms of other eye conditions, and therefore people can be referred to hospitals. The second part, as I said, innovating for both for screening tools, so that it is screening tools are cheaper, they are less complicated, require less operator training, and also the usage of digital tools to accelerate the speed at which products and services can reach people at the bottom of the pyramid. 4.5 billion to raise awareness, to drive demand for glasses, and also to drive external investment, development investment into new and existing services which deal with vision care. And then finally, 6.2 billion to provide subsidized services for people who can't afford. Now, the interesting bit is that if we are able to create these million new sustainable access points, they can provide a very effective and cheap, relatively inexpensive medium for carrying out philanthropy or providing subsidized and free services to people in their communities who can't afford even basic services. Now, although these sound like big numbers and they sound like very challenging targets to have, but as compared to the other health contexts and the investments which are needed in taking care of a health issue which affects so many people, it's not that big as compared to the other investments which are needed for similar health conditions. And the report then highlights that if these actions are taken care of and if these investments are secured, it's it's possible to eliminate poor vision by 2050 in a sustainable way. So that's all from me, and I would encourage you to log on to this website to scan the QR code and download your report. We will also share that link later when Kristan sends in the summary.
Thank you so much, Anurag. And it's exciting to see how two very independent reports actually have this overlap of information that we obviously know that these are critical aspects to growing the vision care space and to addressing the overall need around the globe. My next speaker is Kovin Naidoo. Many of you know his introduction. I will say that Kovin is also on the governing board of the Vision Impact Institute, and we're happy to have him presenting. One other thing very quickly, if you would like to ask a question, please use the chat feature on the right side of your screen. This will allow us to answer your questions at the end. Thank you. Go ahead, Kovin.
Okay, can you see my screen, Kristan?
I can, thank you.
Okay. All right, thank you, everyone. We're running behind, so I'll try and skip some stuff which has already been mentioned. I want to just try and look at what are the implications of these reports in this changing landscape of vision care for optometry in particular, but eye care in general. And what we know that the prevalence of distant vision impairment in low and middle income regions is estimated to be 4 times higher than in high income regions. And when we look at near vision of unaddressed near vision impairment, we find that in a region such as North Africa and Middle East, it's greater than 45%, while the rest of the developed world is closer to 10%. So despite some of the successes and progresses and economic advancement in the Middle East and North Africa, there's still huge challenges that exist. So let's look at the eye care environment. We know, firstly, that when you look at optometry in particular, there's a lack of relevance in public health systems. In a lot of cases, optometrists will exist in a very significant way in the private sector, but not be integrated into the public health system. A team approach is often lacking, sometimes because of interprofessional challenges, but at other times because of scope of training, and sometimes just a lack of optometrists that exist, especially when you consider that your region, by the WHO classification, IAPB, etc., includes countries such as Djibouti, etc. So there's quite a variation that exists. Human resources is a huge challenge, and I'll discuss that separately. But we know that there's been pockets of success, particularly around the advocacy level and the global action plan, which I'll talk about. Your region was the one that led the efforts in getting that adopted at the World Health Assembly. A couple of years ago, I worked with a group of people where the first really comprehensive guidelines for child eye health emerged out of your region. And there's been the political will to implement some of these programs, which I think is very positive and can be built on. We know that some countries have a limited number of optometrists. In others, and in these countries, there's a huge challenge to produce the eye care personnel that's needed, and we'll talk about that separately. We know that there's a maldistribution of optometrists in many cases, and Hassan, Awada alluded to this, that the optometrists are there, but there are communities in rural and outlying areas that are faced with challenges. You have an additional issue that compared to other countries is a huge refugee population that you need to step up and start providing eye care services for. And this has become a huge challenge, and I know there's been some initiatives occurring both by ophthalmology and optometry. The scope of training and the role is a big challenge. In many cases, the optometrists are, even when there's a need for integrated care to be provided, co-management, etc., optometrists are mainly doing refractive services and are not part of the broader scope of services, even though their training is often off the level that can adequately provide those services. And that's a huge challenge that exists in the region. So essentially, the region is a two worlds in one, well-resourced and under-resourced countries. And I think as we move forward and we look at the challenges these two reports bring about, we need to look at how these two pieces can work well together. And there are examples, for example, when we look at what is happening by some of the major NGOs in the cataract space, out of like Al-Basar, etc., that are doing some amazing work in parts of Africa, by especially in North Africa, by collaborating, providing training, etc., and working closely with North African governments. The well-developed private sector is an opportunity, as well as the fact that well-resourced governments is an opportunity. We know that diabetes is starting to become a major concern, and Stuart referred to that. And the Middle East is one of the areas that this is a priority issue that needs to be addressed. And it offers us an opportunity for optometrists to interface not just with eye care practitioners, but with the broader healthcare system, with the physicians, etc., to be part of the process of ensuring that diabetic patients are more comprehensively managed. School eye health is increasingly being elevated on the global health and education agenda, and given some of the earlier efforts of governments, and that guidelines was developed with the leadership of the WHO, but together with the governments in the Middle East. And I think that we need to go back and look at some of those initiatives and how that can feed into the priorities that exist and can be used as strong advocacy tools to get those governments to resuscitate those programs. So, these reports come and go in all sectors. We see this. And the question some of you may ask is, why is this important to us? And is it really going to make a difference? Let me just make one point, that when the Global Action Plan was developed, and I was fortunate to be on the editorial committee of both, the World Report and that, and optometry was mentioned as a separate line item for the first time, and targets for optometry were put there. Subsequent to that, many countries created optometry posts, started integrating optometry into the eye care team, and providing appropriate budgets. So these reports are critical because people want to take evidence-based decisions. And the World Report provides some of that evidence, as well as the eliminating poor vision in a generation. And we need to utilize that. We know we can leverage the data effectively because uncorrected refractive error, which is primarily the responsibility of optometry, is the leading cause of vision impairment and the second leading cause of blindness. But when we look at myopia, which has been spoken about, and look at your region in particular, in 2000, the prevalence was 14.6%. But by 2050, the prevalence of myopia is going to be 52.2% in your region. That's a projection. And that is similar to the more developed countries in the world. And it shows that as the economic growth is occurring, there is going to be enormous growth in the prevalence of myopia. And this raises the challenge that we need to firstly provide access to care, and we need to train people to adequately manage myopia. Stuart spoke about integrated people-centered eye care. The reality is that what it really is talking about and is about looking at the whole ecosystem, looking at how the different parts of the health system, looking at the entire ecosystem operating, and how can that happen effectively. Now, we need, what does that mean is that in many ways we will have to move out of a narrow clinical paradigm and start thinking about how we interface with other aspects of the healthcare system. And that has been a major challenge of optometry. It's been very much a vertical profession, and refractive error does do that. It allows you to be boxed into a particular space. But when we talk about sustainable eye care, we realize that we have to start thinking very differently. And I don't want to repeat some of the comments that have already been made. Human resource development, when we have optometrists in some countries, it's a big benefit. When we don't have optometrists in some countries, we need to start thinking differently. And we know that during the COVID period, I was part of one, but there must have been invited to about 10 to 12 telerefraction, teleoptometry seminars that were occurring in the US. And across the world, people are starting to, even in well-resourced environments, looking at how teleoptometry and telerefraction can be effectively utilized. And we are working as SLO in India, looking at how access can be created where these primary vision care providers are linked to optometrists who provide oversight so that you have a comprehensive eye care services provided. So technology, if we fight it, it's not going to go away. We need to embrace it and look at how it can be leveraged, and with optometrists then being there to ensure that quality eye care is provided. We're working with 115 optometrists and 600 technicians and in India, and those results are very promising at the moment. So we need to look at beyond just the clinical role. And this is a big challenge for optometry because generally that's where we've been stuck in. And I think we need to look at our promotion as an important part of this whole ecosystem that we're addressing. We know that when you set up services, even in underserved areas, unless people become aware of the need for that healthcare service or the impact of poor vision on their lives, etc., beyond just seeing in terms of economic impact, quality of life, etc., and unless they become more aware of these, the uptake of services doesn't also always spontaneously occur. And in India, we have worked with Amitabh Bachchan, who's a film star, and looked at an awareness campaign, which is called the See Now campaign, together with Olos, Sightsavers, and other partners. And that led to a 38% increase in uptake of services at vision screening events that occurred. So there's a big advantage to do that. Advocacy, I think you have a very powerful basis in your region. Previous success by the IAPB structure in the region especially, and the Prevention of Blindness group, PBU in your region, has been very successful in engaging governments. What is lacking is that optometry has been peripheral to that, and I think there's an importance to become central to those efforts to ensure that policy change can occur to ensure that optometrists as well as refractive services become an integral part of services. I spoke about technology. I'm not going to repeat that. I think it's an important driver and we need to look at that. We've heard about the economic case. In addition, I mentioned to you how myopia is going to increase and reach 52.2% in your region by 2050. And recently we published a paper where we showed that the annual productivity loss from myopia alone is 244 billion at the moment. So this is going to have huge economic impact. And again, it's a very powerful case to be used in your advocacy efforts, especially in your region. We're going to live in a post-COVID world. Unemployment is going to increase, reduced disposable income, and health systems are going to be under-resourced because budgets have been depleted in many ways. We have to be prepared to think differently. And I think that it is a time for the private sector to play a more important role. We talk about philanthropy. Can many of the optometrists in the private sector still play the current role, but at the same time spend some of the time engaging in philanthropy so that we can actually reach the number of people we need to? And these are very important challenges. We need a comprehensive approach that talks not about which sector is better, but that the public sector and private sector needs to work together. Spoke about technology, but we need leadership. And optometry needs to take a leadership role in uncorrected refractive error and myopia. If we don't address that, it doesn't matter how much we integrated in the health systems, because the history will judge us harshly, because this is directly optometry's role. We need to be part of a team, and I've spoken about that. And entrepreneurship can become an important driver, especially in this post-COVID world when there's going to be a lack of resources by the public sector to set up services. And, more recently, we've been engaging an optometrist in Somalia who, graduated, went back, and together with a foundation has been able to develop an income-generating program that is now creating amazing access within a very, very difficult environment. And if you had waited for just the government efforts to happen in that environment, that's difficult. So entrepreneurship can be a great driver if we want it to be. So if we do this, we can eliminate poor vision by 2050.
Thank you, Kovin. I would like to open it up now to some questions, and we have several questions on the panel discussion on the side. I'm going to read a couple of these questions. Kovin, can you mute your microphone? I think that there's some feedback going on. I will open it to the questions. I will probably address these to specific people to answer because I believe that it's most of them are directed very quickly to others. The first question comes from Hassan, and he says, will the World Report on Vision be circulated to the ministries of health worldwide? And how will financing the implementation of solutions, especially in countries that suffer from a bad economic situation, how will financing work? And Stuart and Alarcos, I would love for you to answer this question, please.
Thank you. Thank you for this question. It's a tremendously important question. So we need to be aware that all member states and ministries of health, when they endorse a resolution, they are aware of the content of the resolution. And this resolution contains the recommendation, or is based on the recommendations of the World Report on Vision. At this point, I cannot say that everyone in the ministries of health will read the World Report on Vision, but what I can confirm with confidence is that member states would not endorse a resolution from which they are not very much aware, and the Ministry of Health is behind, and it has been a discussion about it in the ministry. So that is also the reason why it's an important document. And in terms of financing, I think independently of the level of maturity of the health system in a country, also when they are very immature health system, the message that the World Report on Vision says is that you need to integrate, you need to consider eye care services, and especially in those immature health systems, essential eye care services into your health planning and therefore into your budgeting. Whatever the budget comes from, and from many countries, the budget come in different forms, from very fragile health system, even from foreigner aid. But what it is important is that from whatever the funding or the limited funding comes, that eye care is part of it, because if you are part of the strategic planning and you are part of the essential services that need to be provided as part of universal health coverage, you need to be taken into consideration into the budgeting, whatever the funding mechanism it is. Thank you.
Thank you, Alarcos. Kovin, this next question is for you. I think that it's important for us to talk about two questions together. One is that, are there any programs to send optometrists out to rural areas internationally? And then really tell us a little bit about teleoptometry. And I think those go hand in hand. So I'd like for you to respond to these as well.
So I think that there are programs to send people out, but those have become lesser and not more. For the simple reason, I think, that even some of the development organizations or NGOs that have been involved in such programs are scaling back that to more sustainable efforts. And when they are sending people out, it's a bit of service delivery for particular populations that make sense, for example, like refugee populations. But at the same time, increasingly optometrists are going out and are starting to train local people to provide eye care or to help develop eye care within those communities. So I don't think we're going to see a growth of outreach. It's expensive, the returns are limited, so we have to start thinking more creatively. And I think that's linked to the issue of teleoptometry, because we know also that when we have these optometrists go to these areas, it's for a period, then they come back, and then after that, there's no services in those areas, and that's a huge gap. However, what teleoptometry is starting to offer us the opportunity to do is a couple of things. It's firstly, reach underserved communities from a distance. I was in Mexico visiting a program of a partner, and they have neurologists sitting in a room, diagnosing people, managing people who are facing potential death, brain tumors, etc. And that got me thinking, is at this level, if they could do it when people's lives are in their hands in a more substantive way, why can't we adapt some of this? And it's great to see the kind of changes and adaptations that are occurring. So it's about reaching people. Secondly, we know that when we set up primary vision care providers, etc., and they're not going through a full 4-year program or 6-year program, there are a lot of issues being raised about the scope of their skills, the quality of their service. They do what they do well, but sometimes they don't have the full range of skills to manage complex situations, and those develop. So teleoptometry allows you to provide that oversight. Technology allows you, now you can measure IOPs with an inexpensive tool that you can measure through the eyelids, and those information can be fed. There are handheld fundus cameras that are becoming more and more affordable, etc. There's an whole range of opportunity to integrate other technology and then be able to provide the service needed. There are people in the US now who, on a regular basis, that's how they practice. They have a technician in a rural area linked to them, and they provide services, etc. And as you know, in that environment, they all are licensed, it's regulated, they are evaluated, and quite frankly, the outcomes of that is very good. Now, yes, there would be bandwidth issues where we are, we'd have other challenges, but I think it is something that we need to seriously look at, because right now we are doing the world report, the global optometry mapping, and some of you have been we reached out to you for information, etc. So you're aware of it, and we're working on the Vision Impact Institute, World Council of Optometry, etc. And the reality is that when you do the projections at the current rate that optometrists are being produced, will take a couple lifetimes to produce enough optometrists to meet the need. Those million service points that we need are not going to happen easily. So teleoptometry, I think, is a way to actually magnify the role of optometry and expand the reach.
Thank you, Kovin. One more question here, and this will be our last question for today. In practical terms, how can optometry be effectively integrated into public health, and then also able to practice to the full scope of their training? I think this is a question for you as well, Kovin.
So I think we've heard various things about strategy. My quick answer to this is no matter what we do, and we know that entrepreneurship is becoming a big driver of access, and we need to look at entrepreneurship as a driver. And, there was a time even the NGOs, they wouldn't work with the private sector. It was seen as like a bad thing. Those things have changed. So I think we all need to come together and we need to do that. And right now there's a discussion about a uncorrected refractive error coalition that's bringing the private sector, etc., together to build that network. However, even if we use entrepreneurship, etc., you have to have a significant number of optometrists integrated into the national health system, either employed, starting to contribute. And we've seen in those countries where that has happened, where optometrists have advocated for posts in the national health system. The Ministry of Health has created posts and have started contributing, not just at a clinical level, but also in terms of health systems planning. Once that happens, then firstly, an appreciation of the role of optometry expands, integration of optometry becomes greater, and the barriers between different professions start breaking down. We all become part of a team. And, I was part of initiating the School of Optometry in Malawi, but one of the things I did when I first went for the meeting there to talk to people is to make sure that I engage ophthalmology. And they were very involved in that process, etc., as part of it. But ophthalmologists who work in the government sector. And after the school had been set up, I got a call from one of the optometrists complaining about the ophthalmologist. And I said, there's so few of you, why are you fighting each other? And he said, well, the ophthalmologist is complaining that I'm referring glaucoma and other things to him. He says he's got enough work, the optometrist should do more things, which was totally the flip side of the argument that was happening elsewhere, because the ophthalmologist started seeing the optometrist in the context. They're referring to each other, and he's saying, hey, you trained, you can do more. And these barriers about scope, etc., start falling apart. So I think we need to get more optometrists working in the public sector for us to really get a true appreciation of the role of optometry. Thank you.
Thank you, Kovin. I think there was someone speaking.
Yes, of course. Yes, of course. Thank you for joining, Ms. Chris. And I have a question. As you know, we have speaking about the refraction. Refraction is the pure optometry's activity. And attentiveness and accuracy is the main point of our job. With teleoptometry, we can consider this accuracy, and we don't have any bias in this this kind of examination.
I think in the programs that have implemented it, a lot depends on the level of training of the technician who's supporting you and the oversight you're providing. It is not an easy thing, and I'm glad you raised the question, because it's not just about implementing it. It has, you need to put in appropriate checks and balances. And the evidence is that if you do that, you can actually provide quality care. But you have to take it seriously. It's not a simple thing, you know, and it's in different environments and in different conditions, you need to look at what it involves and how you can make sure that you have the appropriate checks and balances in place.
Interesting.
Thank you for your question. We'll have to close the meeting at this point. So let me do one thing very quickly. I'd like to just remind you all that you can connect with the Vision Impact Institute at any of these different places, at our website, at the social media sites that we are in especially. And also, Hassan, I would like to know if you would like to share a few words in closing. Hassan, I'm not sure if you're still on at this point. If you'd like to speak, feel free.
Yes. Yeah. I would like to thank you all the participants to this webinar. It was very, very interesting to discuss. Our region is in need of many plans and actions to fight the incorrect refractive error, especially with all the war problems and refugees in our region, especially in Lebanon, Jordan, Iraq, and many other regions like Yemen. So I think we have a lot of work to do, and optometrists can play a big role in this fight, in this cause, because many of civilian people screening and are in need to have eyeglasses, and I think all of us, if we put our hands together, we can reach our goal. And thank you so much for all your efforts. Thank you.
Thank you, Hassan. I wanted to say thank you to IMCO. I wanted to say thank you to all of our speakers. It's been a wonderful morning and afternoon for you all with us. We will follow up with information for you in the next week, including a link to this webinar that you can share with others. So thank you. We will close the meeting now, and we appreciate your participation.